That's good. Now the next one is, what is the best treatment for persistent arthritis, pains, and aches?
The treatment for arthritis depends on the cause. There are different categories or types of arthritis. The common ones that I would assume that we're talking about is the osteoarthritis. Very common with as you age. Simply defined, it's just overuse. Arthritis, when your joints are overused or due to longevity, living long enough, the joints degenerate. So can affect any joint. It can affect your fingers, your wrist, your back, which is a common place, the knees. Those changes, because the bones, the joints degenerate, of course, they cause pain. Common problem that would contribute to that pain is weight gain. The joints are already compromised and we gain a lot of weight, especially like places like the knees, the back. That's why most of our old mothers in those days would tell you they have rheumatism. That's what they used to call it. Affected the knees. So common treatment is Tylenol. We recommend the extra strength Tylenol, which is Panadol. I don't know. I remember in Nigeria it used to be 500 milligrams. I think that's the equivalent of the extra strength. Yeah, we have 325. So you should take, usually we'll take two, which is 625, but for the extra strength is the 500, you can take two of those. That's one. Two is your non-steroidal anti-inflammatory drugs, Motrin, ibuprofen, Proxen, those group of drugs, which again should be taken as needed and sparingly. It's caution, given the other effects that they have. Eventually, there's also physical therapy, which can help depending on the area of the body that is affected. Physical therapy helps, like, helping with mobility and all that. But finally, last, like they say, all else fails, surgical treatment. There have been advances in the way these things are treated these days. I've seen 85-year-old women, elderly patients, they treat them and they go home the next day, even sometimes the same day. That's for osteoarthritis. There are other forms of arthritis, the rheumatological diseases like rheumatoid arthritis and a whole bunch of rheumatological problems. If you have any of that, then you have to address the primary problem, in which case you need to be seeing a specialist, a rheumatologist, to define which kind you have and also provide appropriate treatment. Bottom line, after all else fails, after you've been treated medically and it fails and the joints are seriously destroyed, might require a joint replacement, which is surgery. So in simple terms, that's sure.
Thank you.
Can I can I add
Yeah, go ahead. Go ahead, please.
just to add more on the effect of exercises on osteoarthritis. So as far as physical therapy aspect, it's very much established that exercises, especially moderate exercises, replenishes the lubrication of the cartilages, which are affected by this osteoarthritis. Also, to strengthen the muscles around the joints. For instance, osteoarthritis commonly affects the knees, so you want to strengthen the muscles around the knees, like the quads and the hamstrings. It really helps. Then again, weight loss is key. So, because the increased weight increases the harmful effects of arthritis. So when they lose that weight, they kind of regain some function and have reduced pain. That's the reason why before they even go on to have like a joint replacement, doctor recommends that they be at a recommended body mass index before they go on with the surgery. So I just wanted to add that today.
All right.